Welcome to Helping Hands Clinic. How may I help you today?
Hi, my name is Morgan Williams. I have a 2 o'clock appointment with Dr. Jones.
I don't see any records of you ever coming here before. Are you a new patient?
Yes, I am.
Okay, first I will need you to fill out some basic information so we can put it in our system. You can bring it back to the front desk when you're done.
Why do you need my information to go into the system? My old doctor never did that.
This helps us better organize and access our patients' information.
Okay, no problem. I finished. Here you go.
Thank you. You can have a seat and they'll be with you shortly.
Miss Williams, you can follow me this way. Nice to meet you, Miss Williams. I'll be taking care of you today. So, what made you want to change primary care physicians?
I wanted to switch doctors because at my other doctor's office they weren't very organized. Even during the process of moving offices, some of my records were lost, being that they were paper files.
I'm sorry to hear that. Luckily here we have advanced technology that allows us to use electronic health records with our patients.
What's an electronic health record?
An EHR or electronic health record is a digital version of a patient's paper charts. EHRs are real-time, patient-centered records make information available instantly and securely to authorized users. It contains the medical and treatment histories of patients but is also built beyond standard clinical data collected in a provider's office, and it can be inclusive of a broader view of patient care.
That sounds great, but how does that work?
Well, we take the general information which you provided on paper and create a file in our computerized system that includes your medical history, diagnoses, medications, treatment plans, immunization dates, allergies, radiology images, and test results.
How do I know my information is safe?
Only those who are authorized are able to access your records. It is also kept safe through encryptions which keep our technology secure from hackers or unauthorized personnel.
What happens if the system crashes? Will all of my information be lost?
If our system was to crash, your information would still be stored in the cloud and could be retrieved as soon as things were up and running again. Unfortunately, if the system did crash, it would make patients' information more accessible to unauthorized users, so our office makes sure we have the best technology security to be sure that doesn't happen.
I see. Is there a way for me to access my health information?
Yes, in this system you are able to access physician notes and billing information along with other information.
Wow, that's very interesting. Thank you for providing me with this information.
No problem. The doctor will be in shortly.
Hello, Ms. Williams. I am Dr. Evans. How are you doing today?
Hi, Dr. Evans. I am doing good. Thanks for asking. Before we get started, the physician provided me with the basic information of an EHR, but I was wondering what are some of the advantages and disadvantages were?
Well, Ms. Williams, some of the advantages are EHRs provide accurate, up-to-date and complete information about patients at the point of care. They enable quick access to patient records. This way we can provide more coordinated and efficient care to our patients. EHR also to help improve patient and provider interaction and communication, as well as enhancing the privacy and security of patient data. Unfortunately, some disadvantages are HIPAA violations are more common than a lot of people realize. They, of course, cost more money, and also if they are not updated frequently or after every visit. Other healthcare providers will rely on inaccurate data when trying to determine the appropriate treatment protocol. Does that answer all of your questions?
Yes, sir. Thank you so much.
No problem. So what brings you in to see us today?
I had been feeling a burning sensation when I urinate and a bloody discharge.
Well, how long has this been going on?
A little over a week now.
Okay, well, let's see. When is the last time you've had sexual intercourse?
Honestly, it was about 2 weeks ago.
Did you use protection?
Unfortunately, no, I didn't.
Okay, well, the first thing we should do is test you for STDs through a vaginal swab and blood.
Okay.
I am going to grab you a gown to put on and the nurse will be back and to get a blood sample and a vaginal swab.
Okay, thank you, doctor.
Hello, Ms. Williams. I am Nurse Smith and I am here to draw some blood and also take a vaginal swab, if that's okay?
Yes, that will be fine.
All right, I am going to run these over to the lab and the doctor will be back in shortly.
Okay, thank you, nurse.
Okay, Ms. Williams. The test results have been sent off. It usually takes about 3 days for the results to come back, so once they're back, I'll give you a call to come back in.
Okay. Thank you, Dr. Evans.
My pleasure. Hello, Ms. Williams. Your test results are in, and I'd like for you to come back to the office so we can further discuss them.
No problem. I'll be there shortly.
Hello, how may I help you?
Hi, I'm Morgan Williams. I was called in by Dr. Evans.
Okay, give me 1 second, and I'll let him know you're in. You can have a seat over there.
Thank you.
Ms. Williams, you can come on back now.
I am a tad bit nervous being that you called me in to discuss the results.
It's just protocol that I bring you back and to discuss them because of privacy issues.
Oh, okay.
So, unfortunately, the test results came back and it looks as if you have a case of gonorrhea.
Oh my goodness, I can't believe this.
Don't get too upset, Ms. Williams. You can receive treatment to cure the disease. It is important that you take all of the medication that I am going to prescribe to you. Although the medication will stop the infection, it will not undo any permanent damage that has been caused by the disease. If you take the medication as prescribed, it should be gone in a few days.
I am so embarrassed. I cannot believe this. Thank you for your help, Dr. Evans. I'll assure you I will be taking my medicine appropriately.
Please do, Ms. Williams. I'll see you soon for a checkup.
Excuse me, but did I miss something?
I'm so sorry, Ms. Williams, but it seems as if someone in the office got a hold of your EHR and shared it with the other physicians.
I thought you said my records were safe, and only the ones who were authorized to see my files would be able to? Now the whole office knows about my private information and business.
I'm so sorry, Ms. Williams. I don't even have an explanation for you. I can assure you that we will figure out who was the cause of this and they will have consequences and be terminated.
No, thank you. I will be switching doctor's offices today and I will not be back. I no longer trust you guys. Please send my records over to my new office when you receive their information.